Oftentimes, when we see rhinoplasty patients, particularly those patients, both men and women, who have really large noses, we also really need to assess the size of the chin. This is because we're not only performing a rhinoplasty, but what we sometimes call a profileplasty. In other words, we want the nose and the chin to be in harmony on a person's face. So if you think about it, if someone has a really large nose, it makes their chin look a little smaller. But if they have a large nose and a small chin, then the facial disharmony is even greater. So particularly for patients who might have a large nose that they're going to have reduced, they can often benefit from having a chin augmentation in addition. In general terms, in a female, we like to see the chin come out to a line that drops from the red lip, white lip junction, the red lip, white lip junction, and is just a little bit behind that. For a male, we like to see a chin that on profile comes a little bit more forward. So men are expected to have a little bit stronger chin. So if the chin is a little bit weak or protruded, we can very simply make a fine incision underneath the chin and we place an implant. My preferred implant is a silicone implant. These have been around for 40 years or so now. They're very, very safe. They sit right on the bone, and once they're in place, you never even know that they're there. So this can be simply done at the same time as a rhinoplasty to improve not only the nose, but also the chin, and particularly the overall profile of the patient. There may be some patients, though, who have some malocclusion. That is, their upper or lower jaw may not match. And so in some patients like this, if they have more specific problems, we will refer them to a maxillofacial surgeon, someone who may make some cuts in the bone, called osteotomies, to move the chin forward, or indeed some patients need their chin moved backwards if it's too big, and also sometimes move the upper jaw in order to place ideal position. This is obviously a more complex surgery, and you want to have a real expert do it for you. Most of the time, when this type of surgery is done, also orthodontics are done in order to obtain the ideal occlusion. But certainly many patients can benefit from a simple chin augmentation with or without a rhinoplasty to achieve improved facial profile.